Hi, I'm Corey here at Justworks. Deductibles, coinsurance, copays, premiums, and out-of-pocket maximums are all terms that describe how much a person enrolled in a health insurance plan will pay and how much their insurance provider will pay. Let's start with preventative care. Preventative care, like annual checkups or screenings, is usually covered 100% for members enrolled in insurance plans. Premiums are a monthly fee to keep an insurance plan active. This is like subscribing to a streaming service. I have access to the service even if I don't use it every single day. Employers may choose to cover all or a portion of the cost of health insurance premiums. Premiums do not count towards deductibles. Deductibles are the amount a member must pay out of pocket to cover health services before the carrier begins to pay for services beyond preventative care. So if I have a $300 deductible and I'm visiting a doctor for an illness, I may have to pay the full price of my visit and for prescription medications until my deductible of $300 is met. Coinsurance is when an insurance provider and a member split the cost of a service by a percentage. So for instance, a member might pay 30% of the cost of a prescription refill. Copays are a set dollar amount that members will pay for a specific service. So maybe it will cost $60 to see a specialist like an optometrist after my deductible is met. An out-of-pocket maximum is the most a member would have to pay for qualifying services in a calendar year. The carrier covers 100% of the cost for qualifying services after this is met. So let's say my out-of-pocket maximum was $10,000 and I see a therapist twice a week for $200 per session. Before half the year is over, I may have paid up to my $10,000 maximum for therapy and other healthcare expenses. For the rest of the year, my plan would cover 100% of qualified expenses. We refer to these terms as cost sharing because they are agreements between the insurance provider and the member for splitting the cost of care based on the plan the member has selected. When you're selecting health insurance plans to offer your employees, these cost-sharing agreements are interrelated. Let's look at some insurance plan quotes to see how this works. What's the difference between high deductible and low deductible plans? Something you'll notice with deductibles are that some deductibles will be higher and others will be lower. High deductible health plans, or HDHPs, require you to pay higher amounts out of pocket when you receive care. A member enrolled in a high deductible health plan is eligible to enroll in a health savings account or an HSA. I'll explain more about HSAs and FSAs in another video, but the important thing to know is that both of these accounts allow you to put aside pre-tax money to pay for health insurance plans. The check mark next to HSA compatible tells you if each plan is a high deductible health plan or not. Plans that are not high deductible health plans will of course have lower deductibles, but the premium amount is usually higher. With a low deductible plan, you'll pay less out of pocket when you receive care, but you'll often have higher premiums. You'll also notice that the deductible amount increases as you add dependents versus only having an individual employee on a plan. Let's look at the difference between EPO and POS plans. An EPO is an exclusive provider organization plan, which means members are not covered for out-of-network services. POS plans cover both in and out-of-network services, but we can see here that the out-of-network deductible, coinsurance, and out-of-pocket maximum are higher than in-network services. You will almost always pay more for out-of-network services and providers. We have another video on network types that explains the rules for what is covered in or out of network. But again, the important thing to understand is that all of these cost-sharing elements are interrelated as a member considers the total cost of services each year and figures out what plan works best for them, their anticipated medical needs, and budget. To see the details of the cost-sharing schedule for each plan, look for the Summary of Benefits and Coverage, or SBC, by selecting View Summary of Benefits and Coverage. Scroll down to see copays for specific services like primary care and specialist visits. As you review these options, remember that preventative care is covered 100% by most health insurance plans under the Affordable Care Act. For instance, here there is no charge for a diagnostic test and imaging services that are done by an in-network provider. Preventative care includes annual wellness visits, women's health visits, and other qualified essential care, even if a plan has a high deductible. We see some employees who are generally healthy choose a high deductible plan or an HDHP and an HSA. With an HDHP, members who might not expect to need ongoing medical care could still receive qualified preventative care like screenings and immunizations free of charge. Members can check with their providers to determine whether specific screenings or services will be preventative care at no cost. So we've covered the basics on deductibles, premiums, coinsurance, copays, and out-of-pocket maximums. To learn more about the basics of health insurance, check out our other videos on network types and pre-tax savings accounts.